Hi guys. Hi guys, my name is Dr. Promise and welcome to another episode of Inside Medicine, where we simplify complex health topics and empower you on a journey to better health. I am Dr. Promise and I'm so glad that you guys are here. Today's episode could literally save lives. When I literally save lives, we're talking about colon cancer. I'm not sure if you guys are familiar, but colon cancer has been plaguing so many Americans today. We're talking about Chadwick Boseman, the famous Black Panther that passed at the age of 43. He died as a result of colon cancer. When I say 43 years old, he was just 43 years old. There is another famous influencer. I think his name is Tanner Martins. And guess what? He died at the age of 30. He was first diagnosed with colon cancer at the age of 25. He got chemotherapy, was treated for 5 years, and then he passed, leaving behind his wife and a newborn baby. Now, we're talking about a man who died at the age of 25. Tanner Martins, may his soul rest in peace. And Chadwick Boseman, who is our famous Black Panther, I loved him. He passed at the age of 43, all from colon cancer. Now, this is a topic that has been so dear to my heart, and I really want to talk about this topic. Now, why is colon cancer affecting so many young Americans? You could be diagnosed at the age of 20, you could be diagnosed at the age of 30, 40. There's no limit to these things. I just want to first of all start and just kind of introduce what is colon cancer. It's also called colorectal cancer. It begins in the large intestine or the rectum and usually starts out small. It can start as a very small polyps or a small growth in your large intestine. And over time, this polyps can become so cancerous and can begin to spread into other areas of the body. And when it starts out very small, very tiny, sometimes it's difficult to have any symptoms. For years and years, it will be there. You're not going to have any symptoms. You think you're healthy. And before you know it, it's already become so large and has spread to even become stage 4 or stage 5. The only one thing I want to talk about right now is what are your risk factors for colon cancer? It can happen to anyone. It can start out at the age of 25, 30, 45. There's so many certain American populations that are at increased risk of colon cancer, and that is African Americans. African Americans are at high risk of colon cancer. There are several lifestyle factors like your diet. If you eat foods that are very high in red meat or processed meat, what is that processed meat that we typically eat? I'm running out of thoughts. It's usually found in pizzas. Pepperoni, yes. Sausage, some of this processed, very high processed foods, lack of exercise, smoking, alcohol, all this, lifestyle modification can all contribute to your risk of colon cancer. There are certain symptoms that you should not ignore. One of those symptoms is blood in the stool. When you have a bowel movement and you notice, let's say, a black stool, guys, always take a look at your stool because some people are like, I don't even check my stool. You need to check your stool. Look in the toilet bowl, see what color of stool you have. Is there any blood? Is it black? Is it green? Is it yellow? Is it red? Look in the stool, guys. Sometimes when you see black stool, that's an indication that something is wrong, especially when you're not taking any iron supplements. Because when you're taking iron supplements, that can cause black or darken your stool. But when you know for a fact that you're not taking any supplement that contains iron, there's absolutely no reason for you to have black stools. So when you see black stool, there's an indication that there's some kind of oxidation process going on. Because when you leave blood on the table on the surface for so long, it begins to oxidize, and that's when it turns from red to black. So when you see black stool, when you see bright red blood, there's something going on in your large intestine that should prompt you to be like, I need to make an appointment with my doctor. So blood in the stool, whether dark maroon blood, however color it is, that looks different from your normal stool, please go to your doctor and get that checked out. Sudden change in your bowel habits. Let's say, for example, you're becoming more constipated, you're having more diarrhea, you haven't had the bowel movements in 2 weeks or 3 weeks or even a week. Some kind of change in the bowel habits, you're having more crampy abdominal pain. That's an indication that there's something wrong and you need to listen to your body and have that checked out. Unexplained weight loss. Cancer is one of the most common cause of weight loss. When you notice that you start losing weight, excessive amounts of weight, especially when it's not intentional. You're not trying to lose weight or look like a celebrity or some sort. You need to get that checked out. You're not, when you notice that you're not working out and you're losing weight, or you're not intentionally trying to not eat and you're losing weight, then there's something wrong. Fatigue is another indication that there's something wrong. If you're having ongoing fatigue, when you wake up in the morning, you're so tired, you feel like you're not refreshed, you feel so weak to go about your normal day, things that normally interest you or you normally do on a day-to-day basis, you're normally the kind of person that runs 5 miles every day, and you find yourself not running 5 miles every day, then there's something wrong. Like I say, abdominal pain, crampy pain, all the symptoms or something out of the usual norm should prompt you to have that evaluated. And every normal human being, as long as you're over the age of 25, I recommend you please go to the doctor. I've had a lot of people come to the clinic or come to see me and be like, oh, I don't need to go to the doctor, there's nothing wrong with me. And guess what? They're 40. You're 40. I know you're perfectly in good health. You should go to the doctor. As long as you're over the age of 25, you're sexually active, you should see a doctor at least twice a year. I actually do recommend to go see your doctor whenever you're over the age of 21, regardless of whether or not you're taking any medication, whether blood pressure or any medication. Even if you're not taking any medicine, please go see a doctor and do an annual screening examination and a regular draw for blood work at least twice a year. Every 6 months, you should be drawing blood and checking for every single thing in your body. So let's go back to our colon cancer. So there are so many things that we can do to screen for colon cancer. Usually, according to the American guidelines of gastroenterology, they recommend that the screening for colon cancer should begin at the age of 45. It used to be at the age of 50, but now because of the increased risk or increased diagnosis of colon cancer, they have now moved the age to 45. And honestly, I feel like the age should be at least 40. If you have any kind of family risk or family history of cancer of any sort in your family, your risk even doubles, and you need to start screening at an earlier age. If you have a father, a mother, or a sister diagnosed with breast cancer, ovarian cancer, pancreatic cancer of any sort, please start screening at least whatever age they were diagnosed or 10 years before the recommendation guideline. Let's say, for example, you have a father who was diagnosed with pancreatic cancer at the age of 45. There's no recommendation for screening for pancreatic cancer, but recommendation guideline for screening for colon cancer is 45. Your dad, let's say, was diagnosed with, let's say, pancreatic cancer at the age of 45. I recommend you to start screening for colon cancer 10 years before or 45, whichever one comes first. So 10 years before 45 is 35. So you should start screening for colon cancer at the age of 35. So that's my recommendation, just so you make sure that everything is okay with you. But the guideline still says 45. But if you have any family risk or family history of cancer, your recommendation or your screening should start at an earlier age. So, screening is very important for colon cancer. One of the things that we normally do is what we call colonoscopy, where a doctor goes in, a GI doctor, not me, a gastroenterologist specialist, takes a camera, you're lightly sedated, puts it into your where you poop, and goes around your colon and makes sure to see there is no polyps or any other growth or any abnormality in the colon. He just runs through the colon using the camera that will be shooting on the screen to examine your colon and make sure there's nothing. And if there's anything that he sees, whether like a blood or a polyps or abnormal growth, he normally cuts it off and test it in pathology and lets you know whether or not it is cancer or not. If there is any polyps of some sort, your screening recommendation would decrease. When you have a colonoscopy done and there is nothing that a doctor saw in your colon, for example, then the next time you're going to have a screening done will be another 10 years. So this colonoscopy is typically done every 10 years. Now, if something abnormal was seen in the colon, then the screening guideline decreases to, let's say, 5 years. So you should screen every 5 years. So talk to your doctor and know what's right for you. We'll wrap it up here and we'll pick back up next time. Have a wonderful day. Take care. Bye bye.